Hello there. Today I'd like to talk about urinary tract infections. So what is a urinary tract infection? It's basically a bacterial infection of the bladder. So the bladder is the collecting system of the urine. Urinary tract infections are caused by bacteria. Predominantly they exist in the bladder, but sometimes they can actually go up into the kidney, and that's a more serious condition. But the majority of urinary tract infections simply stay in the bladder. The bacteria multiply in the bladder and cause symptoms like pain, cloudy urine, malodorous urine, and sometimes blood. A more serious consequence of a urinary tract infection is when it ascends into the kidneys. This can cause more severe symptoms like nausea, vomiting, and fever, and that's when one would need to seek immediate medical attention. But for most simple bladder infections, they're generally caused by a bacteria called E. coli. There are simple natural ways to help address this so one can avoid going on an antibiotic so that it doesn't disrupt the bacteria in the gastrointestinal tract and other parts of the body. My name is Dr. Kevin Logan. I'm a functional medicine doctor in Fishers, Indiana, and I've been practicing functional medicine for over 25 years. I wanted to share my experience in treating urinary tract infections in a more natural approach in order to avoid antibiotic usage. These are 3 products that we have put together to help prevent urinary tract infections, but also to help treat those when one is actively infected. The first one is D Mannose. D Mannose is a molecule that comes from concentrated cranberries, and it's one of the healing sugar molecules. And what it does in the body, it concentrates in the urine, and it actually has receptor sites where the E. coli will bind to the D Mannose molecule and then be eliminated in the urine. So this is a very effective way. It distracts the bacteria from binding to the bladder wall where most of them concentrate, and the bacteria, instead of binding to the bladder wall, will bind to the mannose molecule and be excreted, and therefore oftentimes your body can get rid of the bacteria and your immune system will help to eliminate it without having to take an antibiotic. So the second product is a product called Vaginal Balance, and this is a group of bacteria that help maintain the healthy flora within a woman's reproductive organs. A healthy balance of bacteria actually creates an acidic condition which inhibits bacterial growth and yeast overgrowth as well. This is a great product for prevention of both urinary tract infections and yeast overgrowth. The third product is a product called Probiophage. And this is a very interesting product. This is a very specific bacteria which actually goes after pathogenic bacteria, meaning some of those organisms that are causing the urinary tract infection. It targets those bacteria and chews them up like a Pac-Man. So this is a great product when one has an active urinary tract infection. So these 3 supplements are great for UTI relief. The Vaginal Balance can be taken every day as a great preventative. The D Mannose can be taken as a prevention if one is prone to frequent urinary tract infections, and also can be taken prior to intercourse if women are prone to bacterial infections after intercourse. The Probiophage is reserved more for active infection to be taken with the D Mannose and the Vaginal Balance at the same time. At the onset of a urinary tract infection, begin taking the Probiophage and D Mannose immediately and continue on the Vaginal Balance throughout the course of treatment. Typically, we would treat for 5 to 7 days until symptoms are resolved. And if there's ongoing issues, then of course you need to seek medical care. Typically, one should start feeling relief within 1 to 2 days of starting this protocol. As I mentioned before, 90% of all bacterial infections in the bladder are caused by the bacteria E. coli. D. Mannose is very effective for that. If one does not see symptom relief within 1 to 2 days, it could be caused by a different strain of bacteria, and then one needs to seek medical advice at that time. The full protocol and supplements can be found on our website. Please feel free to reach out and call us if you have any questions.